Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is 5 things to ask yourself before undergoing elective back surgery. Over 600,000 low back surgeries are performed every year in America, and unfortunately half overall will not obtain the desired outcome. 10% will actually end up worse than the person was before the surgery. So consideration number 1 is whether or not you should seek a second opinion. A second set of eyes may be indicated since a lot of times low back surgery is a big decision. That person may either recommend the same surgery, might recommend a different surgery, or may recommend no surgery at all. This MRI shows a humongous disc herniation, pinching, so it would be hard-pressed not to recommend some kind of a surgery there. Now, one thing it may be is that they might say whether or not to have a fusion along with it if you're taking out that much of the disc. So, you may ask 10 spine surgeons and you may get 5 different answers. Consideration number 2 is, have all conservative options been tried? A lot of low back surgeries are elective. They don't have to be undertaken, so it should be prudent to undergo physical therapy, chiropractic, spinal decompression therapy, acupuncture, medications, TENS units, interventional treatments prior to undergoing the knife. Consideration number 3 is to truly assess a risk-benefit assessment prior to the surgery. No spine surgery is risk-free. Adult scoliosis procedures, for example, have over a 50% complication rate, and complications may include infection, bleeding, nerve injury, anesthesia risk, failure to fuse, scar tissue, in rare instances, death. You have to really take into account these considerations. Consideration number 4 is to do a reality check on potential outcomes. Think about this. Half of back surgeries do not end up with the expected outcome. 10% end up worse. And think about it. If half of your pain were to go away, is that good enough? Okay? Let's look real quickly at the FDA study on the lumbar artificial disc. Here's the actual lumbar artificial disc. When they did the study back in 2003, over half of the patients in either group, the artificial disc or the fusion, were still taking narcotics a year after surgery. That means that all their pain wasn't resolved, and so even the gold standard treatments still left the patient with a considerable amount of pain. So look at yourself in the mirror and say, if I have this surgery and half of my pain goes away, am I going to be upset a year in? Okay, you have to be realistic. Consideration number 5 is the timing of the surgery. For elective surgeries, you can obviously pick the best time for you, maybe a summer break, a sabbatical, a vacation, whatever the case is, to get it done so you don't miss time off of work, or maybe you want to miss time off from work. Whatever the case may be, you might have paid time off days sitting around. Just consider the rehab considerations. For a lumbar laminectomy, it's 6 to 8 weeks. If you undergo a spinal fusion, it's 6 weeks to 3 months. Adult scoliosis can be 6 to 9 to 12 months, depending on the extent of the procedure. So just think about the timing of the surgery, because obviously it's not something you have to have done tomorrow. The bottom line is the objective is to feel comfortable with the decision, even if surgery does not produce the desired outcome. It's reasonable to work through these 5 considerations to make sure it is the right procedure for you. The Florida Pain Network offers the top non-operative pain management with several clinics throughout Florida. Over 50 insurances are accepted and over 25 treatment options are provided by the board-certified, award-winning doctors. In the Tampa area, visit us at painmanagementtampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.